There are subtle signs of a possible rebound in COVID-19 infections in countries that have already endured their Omicron peaks, while Korea itself has yet to hit the height of its latest wave. For more, I have Professor Yu Byung-wook from Suncheon University here in the studio, of course. Professor Yu, welcome back. I also have Professor Monica Gandhi at the University of California, San Francisco, live on the line. Professor Gandhi, as always, it's a pleasure to have you on.
Thank you.
Professor Yu, let's begin with your thoughts on Korea's current Omicron situation.
Well, today it seems like a little bit peak again, but since last week, we are still in the plateau, but we are step down going up. We can see the end of this big and long tunnel of the COVID-19, especially Omicron variant crisis. How I can say? Because last 2 weeks, we have around 400,000 new cases daily basis, but that's why we are complete now 10 millions. So 10 million mean 20% of all Korean populations, but I believe that we are real count of the patients probably 12 million more. So we are close to the 33% of whole Korean population soon. That's why I can say, yes, today seems like 500,000 cases again, but seems like we are worried, but tomorrow we will be down less than 300,000 cases. So my concern is actually the Omicron tunnel, let me say tunnel at the plateau will be end of this long tunnel will be next of the 10 days from now on. But problem is 2 or 3 weeks more, we can see the certain death rate and casualty from the COVID-19. This is only my concern.
Right, I see. Meanwhile, over in the US, Professor Gandhi, what can you tell us about the COVID-19 situation there?
So we also had the BA1 surge, which was really huge over the winters, over January and February, and that was really BA1. Then BA2, which is a subvariant of Omicron, has come into the United States. Maybe 30% of our cases are BA2. But we're not seeing a clear surge like you're seeing in South Korea, and also what has been observed in Europe and the UK. Not yet, anyway. We may see that still. But all of our metrics now are being based on hospitalizations, meaning mask mandates, anything to do with control of the virus. We are looking at hospitalizations as our main metric. Severe disease is what we need to prevent with COVID-19.
Right, and is that matrix holding steady, do you think, Professor Gandhi?
It is. So the masks, the CDC revised the mask guidance on February 24th, and they essentially said that at this point in the pandemic with vaccines, that we will reimpose mask mandates when there are 10 over 100,000 people in the hospital for COVID-19. Less than 10 means the mask can be released. This has actually released the masks mandates internally inside for the entire U.S. population, and all the states followed suit. And I do think that the hospitalizations are staying below that level, probably for 2 reasons. We have a relatively high vaccination rate, not as high as yours. You've done really splendidly in South Korea with a 90% vaccination rate. Ours is lower than that, but we actually got a lot of natural immunity from the BA1 surge. And if, as you just said, if 35% of the South Korean population has already been exposed to the Omicron variant, in our case, at least 45% of Americans were exposed to Omicron. So we see a lot of natural immunity, vaccination-induced immunity, and that's keeping the hospitalizations low.
Right, I see. And going back to the BA2 variant, the stealth Omicron, Professor, you do remind us a bit about its characteristics.
Well, first of all, this definition of stealth Omicron BA2 is not necessarily using in Korea anymore, because from the beginning, the Korean government and our quarantine system set for the PCR test for the both BA1, BA2 together. That's why stealth means uncovered and the mysterious. That's why we call the stealth. We can say the flights of the stealth technologies. But Korea, from the beginning, we detected BA1, BA2 together. As the Professor Gandhi, she mentioned, I 100% agreed, Because first, naturally immune by the Omicron BA1, BA2, and who are catching the immunity from the vaccination. Now Korea more than 50 to nearly 60% at the moment. So probably because of the BA2 can hit to Korea around the second or third week of April. That's why probably plate going down and resurge a little bit, similar as like the US and Europeans phenomena with the BA2 strike again. But in Korea, now BA1, BA2 mixed and spreading together. That's why this is the pattern of the styles of BA2 Omicron of the US and European one, and Korean can be a little bit different. So you know what? BA2, they have a more key. So surpassed protein, spike protein more than BA1 classic Omicron. That's why we have the research that 30% more transmittable than classic Omicron BA1. That is only one concern.
Right, I see. Professor Gandhi, many countries, including Korea and of course the US, are seeking to roll back COVID-19 restrictions amid hopes, that is, to restore a sense of normality. Having said that, do you suppose these efforts may perhaps be negatively affecting our containment strategy?
So, I don't actually, because the containment strategy prior to vaccines was masks, distancing, ventilation, testing, contact tracing, anything we could do to reduce transmission. Because a case and hospitalizations prior to the vaccines would essentially parallel each other. Certainly not completely parallel, but as cases went up, people who are susceptible to severe disease would get sick. So it was imperative to contain it before the vaccines. However, after the vaccines, the best strategy to actually stop the virus from causing severe disease is vaccination. And if you look at Hong Kong, for example, which is a very good example to me of a place that tried COVID-0, did a lot of all the containment strategies that we just discussed, but BA1 is so transmissible, Omicron is so transmissible, it is hard to contain with all those strategies. And because their vaccination rate among older populations and also the booster rate among older populations is not as high as in South Korea and not as high as in most other places around the world, unfortunately, they are seeing a lot of severe disease. So it's very hard to contain such a highly transmissible respiratory virus, but vaccinations are the key to keeping severe disease low.
Right. Meanwhile, Professor Yu, with regard to the growing presence of stealth Omicron here in the country as revealed by our authorities, do you suppose that particular reality, stealth Omicrons increasing, would perhaps aggravate our hopes of containing Omicron itself, the outbreak here?
Well, someone said, yes, if the government's easing for social distance matter, it make aggravating and make worse the situation. Yes, can be only the region and sector of the public health, which means because now health sector, we are full already. Intensive care unit seems like the little bit breathing from the before, but we are still struggling to select the person who will sending to heaven or who take with us. We are struggling every day. We make the decision on our own ethics. But Professor Gandhi mentioned that. I 100% agree. Even some countries still do the very strict social distance measure, but Omicron variant BA1 and BA2 both are very transmissible. So like human beings cannot control with our human beings, our technologies, and any measure of the social distancing. So, which means these days, Korean governments start to easing very slowly to social distance measure. Actually, this one and spreading to go around the Omicron BA1, BA2 is different. So now how we can handle it? Anyway, we have to go to easy. And we are make a certain regulation from South African way and European way, especially the England, British way, and US way, how they do easing social distance, and then we can be applied the Korean condition. But someone said still better to do more strict this measure, but it doesn't work because Omicron already every corner in Korea.
Right. over in the US, Professor Gandhi, what has been the rate of reinfection amid the presence of Omicron?
So actually the best data on that is frankly from Denmark, that they showed a very large study that if you had BA1, that it's hard to get reinfected with BA2. They're really not that different. There's 3 additional mutations in BA2 over BA1. So over the time period that BA1 really infected a large portion of the Danish population, there was not a lot of BA2 reinfection. And it could be that we saw, again, so much BA1 infection during that last surge in the United States that we're not seeing our cases with BA2 rise as much because we had relaxed a lot of these mandates. Now, importantly, that doesn't mean that another variant can't come and raise cases, but I think that the combination of natural immunity and vaccination is keeping the BA2 surge low in the United States.
Right. And Professor Yu, in the case of reinfection then, are there any differences perhaps in symptoms compared to primary infection?
Well, as you know, I'm a clinician. I have the patient every day. As well, this morning I attend the patient who are highly suspected to reinfected. I'm asked again the PCR. So as you know, definition of the reinfection mean after the recovery 90 days, but PCR came positive, that time we can call, yes, reinfected. So Korea, we don't have much evidence. It's like Denmark, the data, but we are start to found it who has a very early time of BA1 and BA2 reinfected after the 9 days. But most of cases, who, as you know, last November, last year's, we have the crisis with Delta variant. That time, a couple of the number of the Delta variant infected person yet we found it. And then we're having some people, our group of suspicious BA1, BA2, but fortunately, symptom is mild. But as you know, virus, they are kill their cell, kind of joking, because like a Delta and Omicron, they compete to survive. Who going to fast and catching the human cell? So Delta lost. They are now going out. They're losing the military troop of Delta variants now going. They are defected. So how they catch it? Usually host, human being feel very live, mild. That's what we didn't know. And then we can more transmittable. So which means if we get it not stronger than Delta than other, but we catch easy, less transmittable. But anyway, so reinfected mean, according to the definition, yes, we got it now from the different variant before the Omicron. So symptom is relatively mild than before. Anyway, but problem is still high risk groups, risk group more than 65 years and respiratory disease in previously, still very dangerous.
Right. And Professor Gandhi, you have already clarified that the chances of contracting stealth Omicron after an initial bout with Omicron remain low then. Having said that, I'm going to move on to my next question then, Professor Gandhi. What countermeasures do you propose, perhaps, to deal with the reality of reinfection, especially as the world seeks to perhaps accept COVID-19 as an endemic disease in the future?
Yes, I mean, I have to remind us that this acceptance of COVID as endemic is really not because we didn't try. And if you're looking at COVID zero strategies in China, for example, there was an incredible attempt over the last 2 years to eradicate COVID. It simply isn't possible, and it isn't humans' fault. It is because there are animal reservoirs, 29 of them at least. It is because it has a long infectious period. It looks like other respiratory pathogens. So unlike smallpox that you could eradicate, you can't pick it out and know immediately if someone has COVID. And then the fourth reason is our vaccines are actually not sterilizing with each successive variant and antibodies going down. So the biggest strategy that we can use to keep people safe from COVID-19 is boosting the elderly. So essentially, and elderly have to be boosted, probably over 60 in every country. We've really seen that discrepancy in Hong Kong and other countries, that New Zealand has higher rates of boosting in older people, though they tried COVID zero. Hong Kong doesn't, and unfortunately Hong Kong's having severe disease. And we may need a fourth shot for those who are older even older still and immunocompromised. And that's what's being debated right now in the United States, whether older people over 70, over 65 will need a fourth shot. UK has already approved that. The NHS in the UK has said if you're over 75, you should get one more shot.
Right. And as a medical expert yourself, Professor Gandhi, what are your thoughts on the necessity of a fourth shot, of a fourth dose of COVID-19 vaccine?
You know, I do not think that it's necessary for everybody, because what happens is it raises your antibodies up temporarily for about 4 months, but your B cells and T cells, which are generated by the vaccines, do keep the majority of us safe from severe disease. However, there are people who, when they're older, they actually need their antibodies high all the time, because they can't wait those 2 to 4 days, maybe 5 days, for the antibodies to be made by B cells, because they're more susceptible to severe breakthroughs. So it's really going to be older people only. Over 75, again, is the UK way. Sweden is saying over 70 who will need a fourth shot, but not for the majority of the population.
Right, good to know that. Professor Yu, one more question on reinfection before we move forward then. Now, are a person's risks of reinfection perhaps affected by the severity of his or her symptoms under the primary infection, or perhaps by whether or not he or she had suffered a breakthrough infection?
Well, we have a very, very interesting research done in one university hospital in Korea last year after the vaccination. So you remember messenger RNA type or the another type of vaccination after the vaccinated, we have certain symptoms who will say, I got nearly death after the vaccinated. So we believe that, symptoms after the shot, who got the serious, that time I got more imminent, I feel more relief. But result was disappointed. Why? Same. Who are after vaccinated, and then who are feel mild or feel nothing, or who got difficult after vaccinated. Anyone who had the same immunity has it. But case who are infected from the COVID-19, recently with the overseas data is a little different. Who got serious symptoms after the direct infected from COVID-19 virus infection, they have a more imminent, even they got reinfected, their symptom is very mild. So we have the two different phases, the research. So after vaccinated, who are experiencing a bad experience, but anyway, immunity are same. But who catch it, naturally infected from COVID-19 virus, they have a bad experience from that kind of infectious condition, they get more immune. Seems to why? Because less chance of reinfections.
Right, I see. And Professor Gandhi, looking ahead, do you suppose our experience with COVID-19 has perhaps raised or better prepared us for possible pandemics in the future?
Yes, I think that what we need to figure out from what the COVID response was, and every country did it differently, we need to figure out what worked and what didn't. And that kind of referendum on the response needs to be written, meaning, did this, really, I can safely say that vaccinating older people was the most effective strategy to prevent deaths, but especially when we got the vaccines. But we do need to figure out what worked, what didn't, what we can spare. Schools, for example, needed to be open. And I think every now country has recognized this, because children were less at risk and children need to be in school. And then finally, what was amazing is how quickly we got the vaccine. And it's profoundly important to realize that we now have the technology with the mRNA vaccines to very quickly make a new vaccine against a new pathogen, so that it won't take, it already was very short in comparison. March 11th, 2020 was the first day the WHO declared a pandemic, and December 14th, 2020 was the first EUA of a vaccine here in the United States. That is very short compared to other pandemics. In this case, however, now that we have the mRNA technology, it will be shorter still for a new pathogen. And so I think that's the biggest thing for me that came out of this pandemic management. And then again, figuring out who's at risk, who's not, and letting people who are less at risk, be in their normal activities like school.
Right. And aside from vaccination, we also have proactive testing, of course, to contain our outbreak here, especially within the academic arena, Professor Yu. Having said that, after a PCR test, Professor Yu, we normally expect one of two results. Either you're positive or you're negative. But some tests, however, have resulted in being indeterminate. What does that mean?
Well, indeterminate is kind of curiosities for us. Before Omicron, we can judge very easily. Indeterminate is not judge it for positive side or negative side. We can say, let's do test at 24 hours. Why? Because we detected very small number of the virus. That's why we cannot make the decision who got it, even who didn't have any symptoms. But after the Omicron variant crisis, we can say probably you catch it Omicron a couple of weeks before, but you didn't realize that. So who has the symptoms? With the indeterminate, we have to ask them, you have any difficulty to swallow it? So your voice was changed, but you didn't test it. That time we can say probably you're indeterminate from the Omicron, but you didn't recognize in this moment. But the definition of indeterminate before, last year and this year can be a little bit different.
Right, I see. And Professor Yu, a number of people are opting to take cold or flu medications at the slightest sign of an Omicron symptom, even in the absence of a confirmation to say that even in the absence of a diagnosis, that is, as a preventative measure against COVID-19 infection. What are your thoughts?
Well, there are no way to prevent it to Omicron variant. Only one is vaccination. So people believe that this over-the-counter medications is the easy medicine, can relieve your symptom. That's why you think, yes, this is the one red pill help to prevent my Omicron. Not. It only release your symptoms. Virus always with you. So you know that this day in some, not much, but some people in Korea, they do groups we can call shy Omicron, which means they suspect themselves, but they didn't test it. But you can be another source of the research and close infection. Please do test. The medicine only help to release your symptom, cannot prevent it. Prevention is wear your mask, keep your personal hygiene and social distance measure, and don't forget your vaccination.
Right, Professor Yu, thank you for clarifying that. Thank you very much for your time as well. And Professor Gandhi over in the US, as always, thank you for your insights.
Thank you.